Welcome to the Weekly Whisper. This is our weekly video that covers a new topic every week. Today we're going to talk about how to book a virtual appointment in using telehealth, using our software platform. And I have with me Lauren and Bill from Microsite Health. Hello, Lauren. Hello, Bill.
Hi.
Hello, everybody.
All right, let's get right to it. Lauren, this is obviously a hot topic right now, and it's something that a lot of our clients are using and getting into. And once they jump in, the next logical question is, once they have it, is, all right, now I've got this great piece of software. How do I use it? How do I book a teledentistry or a telehealth appointment?
Yeah, this has been, just the topic of all of our discussions with our clients across the nation. Because, you really can't put your hands on a patient's mouth in a video appointment. So what are these discussions like over the phone? So when a patient's calling in, it could be for an elective procedure, or it could be them calling in because they have a toothache. The person answering the phone has got to immediately kind of put on their sales hat, so to speak, and really and truly empathize with the patient from the moment they answer the phone to the moment they attempt to book the appointment. The patient won't be sold once the phone rings, because they don't really know what they're calling for. And so there is a complete process that they must take this patient through. We use patient journey. We use that term in the marketing world a lot. And that's a lot of times what we want to help sharpen up, right? So when the phone rings, we immediately want that team member to get the patient's name, right? We want them to immediately get that connection. We want them to engage with the patient. Once they determine what that patient wants, they immediately need to say, you know what? Hey, doc is seeing patients right now in video appointments. We can just get a look at your mouth. We can kind of tell you different things, different options. We can create a plan for you, and then we can probably give you an idea of how much your procedure is going to cost. And we can ideally see you today. Can we go ahead and get you on the schedule this afternoon? It's just a very easy, less than 60-second approach to getting their needs met immediately, because it's likely there's not too many people in the area that can meet their needs that fast. But you have to practice that talk track over and over again, because it's likely not too many people in the area that are doing video appointments for dental needs.
How I know something that comes up a lot is what's the difference? How do you treat a virtual consult different than a phone, a call that comes in, or even a treatment, even a scheduled appointment? How long should it take? What should you cover? What can you do? Like, what are some of those tips?
So I'll jump on this one. So if we're doing let's say an implant consultation over a video appointment, there's a bedside manner and the treatment coordinator can totally do this as well. There is a bedside manner that goes into a video appointment. When a patient is there, you have to think about all the different reasons why a patient is missing a tooth. It could be trauma. It could be, bad oral hygiene. It could be fear of the dentist. Whatever the reason is, I can guarantee you right now, 100% of the reasons are bad. That a patient has a missing tooth or, a full denture. So with all of those reasons already, have happened or in their mind, plus, a global pandemic, you are in front of them with their fears. So at that moment, you have to be as empathetic and as passionate as possible, putting on your best smile, saying all the great things about the dental practice, and not so clinical and boring, but you want to use their name as many times as possible. Throw in a few jokes, connect with them. If they say, don't use all those clinical terms. If they say, if they use the term denture, use the term denture. If they use the term all on 8, you use the term all on 8. if you want to give them comfortable ways to retract their gums, it could be a spoon, it could be their pinkies. If you tell them, smile real big, you want to smile real big with them, you have to make them comfortable because you want them to relax so you can try to give them the best possible plan to get them to as close as to a diagnosis as possible, because we know we can't do that without x-rays, right? So the goal here is to get them to relax. You have to get them to relax. You want them to relax first, so then you can hopefully get them to, ask for some money, later. I don't know, Bill, if you had some things you wanted to.
Well, I was going to ask you what you thought of this. And so one of the biggest things is when a phone call comes in, and they have to put their sales hat on. And oftentimes the term sales to a lot of people is a bad thing. And so, I'm not a salesperson, I don't want to do this. And it's really, I think you did a good job of setting up the fact that you're really not selling necessarily, because you're empathizing with them, you're becoming an advocate for them, and you're just explaining in a way that really works for them. But it's still, even all that isn't for everybody. And I'm wondering, when you talk to a practice, what do you say to them, or how do you help them decide who should be answering the phone? Because not everybody should be answering the phone. If it's a full arch call, if it's an elaborate procedure or treatment they're looking for, you don't want just anybody answering that phone and talking to that person. You want someone who can sell effectively, has the personality that you've described here, and not someone who's rushing. You're like, "You want an appointment? Fine. When? Doctor's not in that day. Don't you know that?" And so. I'm curious, what do you say to doctors or the whole team that helps them understand that this isn't for everybody? You really kind of need to cultivate, which is what I know what we do. We cultivate a star in their practice. So how do you help determine who that person is at the practice?
That's an excellent question, because we have actually had these conversations with doctors. So they've had to really, really pick people in their office who exude leadership, who have excellent phone and personal presence, great interpersonal skills, people who smile through the phone and in person, individuals who connect with patients immediately, individuals who don't mind talking about money, individuals who smile all the time, where it's not a struggle for them to smile, or if they don't smile all the time, they're confident in some way. Because they may not be a natural thing to you to smile all the time. So I'm not going to say that, but they have to have confidence and leadership about them, because you're having very difficult discussions with patients about usually very expensive procedures, whether they be elective or not. We all know that dentistry is not inexpensive by any means. So when you're picking these people in the office because we all know that right now these dental offices, their teams have significantly reduced. So whoever you are picking to answer the phone, to book these virtual consults, and then potentially do some of these virtual consults, you need a leader who is confident, who doesn't mind talking about money, and has great interpersonal skills. That may not be the receptionist. That may be the office manager who's serving a dual function. That may be the treatment coordinator who's now serving a dual function and answering the phone as well. Okay? Yeah, go ahead.
I have a hard one for you now. And here's, so you have the right person on the phone, and then they're on the phone, and almost instantly this person is not right for the treatment for whatever reason it is, but they really want a friend on the other side. So they start talking and talking and talking. How do you, as a person at the practice, a treatment coordinator, nicely dispose of them, basically, and get rid of them?
And you're saying they essentially are not financially qualified?
Financially qualified, or you can tell that they're not even all that interested. They just want to talk to you. Because a lot of times people get on the, not a lot of times, a few times they get on the phone, and you can tell they're just going to talk, and they want to tell their life story. And you have time to listen to life stories. So what do you do?
Oh, if you could just hold on 1 second. A patient actually is calling on the other line. If you could just, I just need to triage this patient. If you could just hold 1 second. Just give me 1 second. And then you mute yourself. Give them about 30 seconds. Mute yourself. come right back on. Okay, so great. So, Bill, we were talking about potentially booking you for a procedure.
Tell you where I left off though, Lauren. It was about my auntie, and it was about 5 years ago, and she's
Oh
like,
yeah, no, I totally understand. So we were going to get you back in for that 3D X-ray. So in order to get you to the next part of the procedure, which is the 3D X-ray, we just need to go ahead and get you pre-qualified with Green Sky. I can do that for you right now if you don't
boom.
mind. Yeah.
That's it. Boy, if we could just underline that for folks, because that's got to be, when we're listening to calls, that has got to be the biggest challenge that we got to try to help them overcome, was that. And I hope people listen to that last 2 minutes, because what you said, I think was
well, and I think, since we listen to so many calls from these practices, and we can hear what works and we know what doesn't work, is the treatment coordinator, whoever's answering the call, has got to control the conversation.
Yes.
Right. It can't be just yes and no answers from the treatment coordinator. The treatment coordinator within the first 30 seconds has to establish control of where do we want this to go. And that doesn't necessarily mean like go for the sale or go for the appointment right away. It's asking questions that put the person at ease and then lead them to eventually, hopefully making them feel comfortable and wanting to book treatment if they're the right fit for it. So it has so much to do with controlling. If you let the caller control it, you're right. You don't know where you'll end up, and it could be 20 minutes for no reason, right? And there's no benefit or there's no end. Whereas, if you control it and take it, and that's not I wouldn't say that's most people really don't have that skill, because it's not something we're all born with. It's something you learn.
That's why you have to pick the right person to serve this function. It's not just, something that every receptionist can do or every, billing coordinator can do. You have to put the right person in this role in order for, especially if you're running an ad campaign or a Facebook campaign, in order to really get the proper return on your investment, you have to have the right person in that role. Right. And in order to control a call, you have to be confident.
Lauren, you actually had a good, I think, technique when someone that you take control right off the bat. And I think there's some bad questions to ask first. One of them is, how can I help you today? How can we help you? You're basically ceding control at that moment versus the opposite. Do you want to talk a couple of minutes about how you take control from the minute you say hello?
So on a phone call, you immediately start asking questions to the patient, and not necessarily inside of a consultation, but when a patient is calling in an office and inquiring about service, and let's say they say, how much do the implants cost, right? Assuming that you already have the patient's name, you could, or if you don't, you could say, oh, that's a great question, but first, what's your name, right? And the patient will say, okay, well, my name is Shirley. Shirley is always my patient name. And then you say, okay, great. Well, great, Shirley. Well, tell me what's going on. Why do you believe you need implants? You like immediately get into, the clinical need, right? Well, I've been to the dentist before and they told me I need implants. Okay, well, tell me where about in your mouth. Tell me, is it in the back, in the front, the top, or the bottom? Oh, it's in the top. Oh, it's in the front? It's in the front. Oh man, did you have some trauma? Like keep getting into the clinical need, right? And if have you been missing teeth for a long time? Well, it sounds like you probably need a consultation. And the great thing is that we're doing them in virtual consult, so we can probably get you in really quick and the doc can get a real good look in your mouth. How about that? Do you want to do a virtual consultation today? Doesn't cost a thing. You can do it from the comfort of your own home. All you need is a cell phone. Just that quick.
Right. And we kind of when we talk about virtual consults, are they the same for an implant procedure than just a general procedure? So I know right now a lot of people are using virtual software for just general appointments and questions. And is it the same or different if we're talking about somebody looking for implant? Because I feel like we jumped from one to the other, and I want to make sure because I think they're slightly different in how you deal with them, right?
It's different. Definitely different. So someone calling in because they have a toothache or, a prescription refill or, just a general appointment, that is totally different. And so, and there usually is a fee that accompanies that type of appointment. And that has been probably the biggest shift and the biggest struggle in terms of that talk track for a lot of our dental offices, because they are having to triage a lot of these general office visits into a teledentistry platform. So when patients are calling in saying, I think I cracked a tooth, or, I'm having a toothache, that's when the person answering the phone needs to say, okay, well, you know what, right now we're closed for emergencies. We're closed really only for emergencies, but we are open for virtual appointments. So we can have the doc take a look at your mouth. The visit is only $65, and he can take a real good look at your mouth, let you know if you need to come in or not, or maybe he can write you a prescription or a steroid, and that can take care of you until we really get open for business. And that is working really, really well across the country. And we've got accounts in, states in pretty much half the country, and it is working really well. So it's a totally different talk track from someone shopping online for an elective procedure versus a patient looking for, a cracked tooth or a toothache or something like that.
Lauren, I'm just curious to wrap this up. I was thinking, if I could give you a magic wand and you could correct one thing at the most common practice that's done incorrectly or something you can improve upon, what would you do? What is the one thing a practice can do today that would significantly improve their ability to better qualify, vet, and ultimately schedule people who call in for an appointment?
Every office has to have the right person in place to answer the phone, period. And whoever that person is has to practice. And that's why we're here. They utilize me all the time. I'm their sales coach. We partner with our accounts and their teams to make sure that talk track and that script makes sense for the person answering the phone, but it has to be the right person. They can't be meek or, mild-natured, without no confidence. They don't smile. They don't ask for patient names. They don't look at the website. They don't know the advertising. They don't understand clinical procedures. They don't vet patients. There's so many things that happen when that phone rings. And especially now, the phone, outside of your website, your phone is your most valuable asset. So you really, really need to invest in having the right person answering the phone. I will just leave it at that.
Awesome. Got it. Well, that's great. I tell you, we could go all day here because there's still so much more to cover, but we'll cover it. We'll cover it next week in the Weekly Whisper. And it's funny, as we were talking through that, I thought of our next topic, which you'll have to wait for. So thanks, Bill. Thanks, Lauren.
No problem.
Thank you. Be safe.
All right. Bye, guys.
Bye.